The second dot point relating to STEM 1 is soft tissue injuries. And here we'll look at things such as tears, sprains, contusions, skin abrasions, lacerations, and blisters, as well as the inflammatory response. We're looking at tears, sprains, and contusions. A tear, as it says here, is a disruption of fibres of a muscle or tendon. Right? Tears occur when the muscle tendon is overstretched or the muscle contracts too quickly. The severity of a tear can range from microscopic to small to a complete rupture of all fibres. If we look at the picture down the bottom, we'll see that in A, for a muscle strain, that's going to be obviously microscopic. It's only very, very small where it's circled there. If we look at B, that's going to be classified as a small tear, and C would be known as a complete rupture. A sprain is a tear of ligament fibres. We know that ligaments help support the joint, right? So anything involving the joint is going to be classified as a sprain, and this occurs when the joint is extended beyond its normal range of motion or movement, and it's obviously going to be very popular around the ankle joint. A contusion or bruise is bleeding in the soft tissue. And again, this can be caused by a direct blow from a person, implement, or an object. We then come to the inflammatory response. The inflammatory response is the initial stage of repair of body tissue involving the first 24 to 72 hours following an injury. There are 3 stages to the inflammatory response, and all students would be required to understand the 3 stages. Stage 1 is the initial inflammation with pain and swelling. Stage 2 is the destructive phase after 48 hours when damaged tissues are broken down. And stage 3 is a repair phase leading to healing, taking 1 month to 6 weeks. Just to give you an idea of the importance of the inflammatory response, if we look at the diagram underneath here, it shows you 2 different things. It shows you when injury has occurred, and then there's the use of RISA, and then there's no use of RISA. And it just shows the amount of scar tissue being the red on the injury that is caused because RISA hasn't been used, obviously the use of ice, right? And the impact that it has on the actual area or the scar tissue that's formed in the area of the injury as a result of not using the ice, compared to when RISA is used, the severity of the injury and the better it feels and how it looks following the use of RISA. So phase 1 is the inflammatory phase. This is characterised by pain, swelling, heat, redness, loss of function, increased blood flow to the area. This stage may last from 3 to 4 days. So this is the initial impact that occurs once the injury has happened. All right, so the player rolls his ankle, the initial pain, the swelling, the redness that takes place for those first couple of days, that's phase 1. Phase 2 is the repair and regeneration. This is characterised by formation of new fibres, the production of scar tissue, and the elimination of debris. Now, scar tissue is going to be formed. There's been an injury, so scar tissue will be formed. The idea is, or the most important factor is to reduce the amount of scar tissue that can be formed. All right, so that's why the RISA is very, very important. The use of ice and compression and elevation is going to reduce the amount of scar tissue that is actually formed in the injury. This stage, stage 2, may last from 3 days to 6 weeks. So you got phase 1, first couple of days, then we move into phase 2 for the repair and regeneration phase, anywhere from 3 days to 6 weeks. The third phase is the remodelling phase. This is characterised by increase in scar tissue. The replacement tissue needs to be strengthened. So excessive exercises too early will further damage injury. Too little exercise will allow large quantities of scar tissues to develop. And as mentioned previously, we don't want scar tissue to be developing in the part of the body where the injury occurred, because that's going to increase the chances of an injury occurring again. This stage may last from 6 weeks to many months.